guys, it's Autumn Skylar Sings here, and today I am coming at you with a new video, kind of talking about my experiences thus far with my surgeries as well as where I am right now. So yeah, stick around and I will be discussing that. So first off, I wanted to address the fact that you guys are finally for the first time seeing me in a wheelchair. I have always done videos in my room, which is on the second level of my house, so you guys have never seen me in a wheelchair unless you follow my private not my private Instagram, because it's not private, my personal Instagram, because I have posted pictures of me in the wheelchair there, but I've been kind of not secretive about it, just when I make my videos, I typically like to do them in my own space, and my own space is on the second level, and obviously my wheelchair cannot levitate itself. So you've never seen me in it before, so this is a first, and yeah. I've always been in the wheelchair, not always, but for the past, 2 or so years I have been in the chair. I just have never shown you guys on the channel. So this is not my wheelchair, this is the wheelchair of the hospital that I am currently in, Children's Specialized Hospital, for my rehabilitation. But eventually maybe I will show you guys the wheelchair that I have at home. But it's going to be like a month at least before that's even a possibility. Anyways, let's get it started and let me talk about some of my experiences. So first off, let me describe the surgeries that I had. I had the revision of my laminectomy. I had the duroplasty. I had the cauterization of the cerebral tonsils. I had a titanium wire mesh put in around the dura, and I had the fusion from cervical C1 to C6 to fix the neck instability. And there might be something that I'm missing, but yeah, if there is something I'm missing, you're just gonna have to deal. But there's a lot. So that was fun. I don't really remember a lot. I remember everything leading up to the surgery, but pretty much nothing for the 2 days after, which is good because I had a really, really bad experience. Supposedly, just going based off of what nurses, doctors really never talked to me about what happened. I mostly learned from the whisperings of the nurses as well as the direct explanation and retellings from my parents. So what ended up happening after surgery is I was in so much pain that when they were giving me the medications, it was a very, very fine line between me being overly sedated and not sedated enough. And when I was overly sedated, I was very, very close to needing to be intubated, as well as semi-close to being in a coma. None of the doctors really talked to me about the severeness and the significance of those events. I had to learn that from my parents. I was on Dilaudid, and they actually ended up having to give me Narcan, a small dose, but Narcan, for those of you that don't know, is what they give heroin addicts when they overdose. So that's great and fun, wonderful, love it. So that happened. I was really close to dangerous territory. I was in dangerous territory, but luckily I did not pass over to that dangerous, really, really bad state. While I was in that sort of in-between state, they were having to rub their knuckles on my chest. My mom was having to remind me to breathe. My respiratory rate was pretty bad, and when they went in and checked my pupils, they would not dilate. They stayed pinpoint. So pretty severe and significant stuff went on, and pretty scary stuff looking back. Well, I can't even look back because I don't remember any of it. I only remember the last 2 days that I was in the PICU, because I was in the PICU for 4 days, right? I think 4 days. Before I was moved to a normal inpatient setting, and then transferred to here from New York Presbyterian / Weill Cornell. So you also guys might notice that I'm wearing a different collar. The reasoning for that is while I was in that really, really bad state, I was vomiting a lot. Abdominally, having a lot of distress. I ended up vomiting into my collar, and they had to change it out, and they didn't put it on right, and also apparently the Miami J never really fit me 100% because according to the orthopedist that we saw while I was inpatient in the PICU, I have a very, very small neck. So that's great. Love having a dainty neck. I'll take it. Sorry guys, I'm having to do this in little increments, so this is going to be an edited video. Because not only, are just, the staff coming in here just to, do their normal stuff, but I get meds like every hour on the hour. So, people are going to be coming in here and disrupting this, which is fine. Obviously, they're doing their jobs. But, this video is going to be a bit choppy because I'm going to have to edit it. And it's also going to take me a little longer to get this up. Anyways, what we were talking about was dainty neck and the new collar. So I'm currently wearing the Aspen collar, and it is great. I love it. I can manually adjust it with this little knob to push my chin upright and into the correct position. It keeps me stabilized. It keeps me perfect. It's fitted for my neck, and everything's just pretty much great. And if we had any doubts before, I've talked about this before, how, before I had the Miami J, I was having those episodes, whatever you want to call them, really intense full body muscle spasms, opisthotonus, whatever terminology you want to use, whatever they were happening. And they ended up happening again in the PICU once they changed out my collar to the one after I vomited into it, the one that didn't fit right. But then once I got into this one, those completely stopped. So if we had any doubts about the fusion helping as well as the collar helping, they were alleviated. This collar I'm going to have to wear for 6 months, so that's going to suck, but at least you guys can actually see portions of my neck. So it's not as though I'm completely neckless and, sadly, without a neck. That was a really long-winded way of just talking about my neck. So I'm really happy with the Aspen. I love it a lot more than the Miami J. I really notice a difference. And yeah. So now I have been transferred, as I stated, to Children's Specialized for my rehabilitation. I've been here before. The last time I was here, before I had all of my long laundry list of diagnoses, and I only had the diagnosis of the Chiari. They tried blaming all of my problems on anxiety, on PTSD, trying to tell me I had amplified pain syndrome, all of which were wrong and just uninformed and incorrect. Now we know that I have the basilar invagination, the Chiari 1.5, not 1, because of the 28 millimeter dangling cerebral tonsils, which have been fixed with the cauterization. We don't know how much yet. We won't know until my post-operative MRIs, but hopefully they are quite significantly shriveled up now. We also have the Ehlers-Danlos syndrome, the craniocervical neck instability, and all the other junk that Weill Cornell diagnosed me with. Oh, and the myoclonus. So that's great. I have a completely different team this time. I have a different doctor, different physical therapist, different occupational therapists. It's all changed and different and better, and I don't have that one doctor that just decided it was anxiety because I have anxiety disorders and post-traumatic stress. So that's great. They all are not questioning me. They're not trying to blame me. They are taking their cues from Weill Cornell, listening to my neurologists, neurosurgeons, all of that jazz. And really, the treatment is like night and day. They're being really effective, really comforting, and really helping me to stay in a positive headspace and stay motivated, which is the most important thing. I really feel as though I'm being listened to and as though my conditions are not just being blamed on me. Because that was the big thing that we dealt with last time. And I'm actually really glad that I came back here, because even though I was really hesitant and really afraid that I was going to experience the same treatment, now that I have all of this evidence against what they originally thought, they are listening. And that's always been my biggest thing, is I've always wanted to be listened to. I've always wanted people to understand that I knew from the beginning something was wrong, and if they had listened to me from the beginning, you know, maybe we would have avoided a lot of this. But you can't think like that. You've got to just think that at least now they're listening. At least now they're not blaming it all on me. And at least now I can move forward and hopefully move past these 3 years and become a bigger, better, stronger individual all around. And that's a really exciting prospect. And I'm really looking forward to seeing how physical therapy and occupational therapy is going to help me this go around. I think that I'm in the right headspace. You know, I do have my difficulties mentally. I'm still struggling. And I've never really talked about that with you guys. Eventually I want to talk about some of the things mentally that I deal with, because there's a lot. And there's a lot that I haven't told you guys, a lot that I've kept to myself, because, you know, mental health is a lot harder to discuss because, you know, you feel a deep sense of shame and guilt and embarrassment. And, you know, there's no machine that someone can put you in that can tell you how to fix your depression or tell you how to fix your eating disorder or your anxiety or your OCD or post-traumatic stress. There's no treatment that will 100% fix you, and it's a lifelong battle. And it's different with the physical limitations because, you know, they know what's causing it. And not that they don't know what's causing the depression or the post-traumatic stress. They do. We know what's going on with that. I do know what's happening in my head, but it's different. And medically speaking, doctors look at mental health and physical health as two completely different things, and really they're interconnected. The mind and body work in tandem together, and mental health is just as important, if not even more important sometimes, than physical health, because honestly, if your mental health is decreased, you're at more likelihood of your physical health deteriorating. And if your physical health deteriorates along with your mental health, you're really not going to be able to bring yourself back to where you need to be, because mentally you're not strong enough. But, you know, the psych team here really is treating me a lot differently. I'm more open and honest. Well, I'm trying to be, but it's hard. But I'm really determined, I'm really focused on my goals. I'm very goal-oriented this go-around. And also I feel as though I'm being listened to, and it's really a lot easier to work hard when your team is listening to you. It's easier to fight for yourself when you don't feel as though you're being blamed for getting worse. And, you know, I really do have a good feeling about this, and I just am really hopeful. And that's a good headspace to be in. And even though there are other things going on mentally, and I'm not perfect, and I still have bad thoughts, and I still have moments of despair and all of that, I'm working hard to get through those times and to focus on tomorrow. And I think that's the most important thing, is to focus on how great my life can be, and to focus on where I'm going to be a week from now, a month from now, a year from now, and to think about the person that I'm becoming. And even though I don't like myself, even though I hate myself and I have dysmorphic thoughts around myself, I can at least say that I am in a much better place and that I am a much better person than I was. And I am on the road to working towards bettering myself. And that's really all that you can hope for. So, yeah. I'm doing my best to keep a positive outlook, and I hope that for those of you that are struggling with things similar to me, exactly the same, completely different, whatever, if you're mentally struggling, physically struggling in any way, I hope that even someone like me can give you just a little bit of hope that even though it's hard right now, maybe tomorrow it's going to be better. That's all you can hope for. So yeah. I hope that you guys enjoyed me talking. I hope that this gave you some more insight into some of the things that have been going on. I hope that for those of you that are struggling or that are in a position similar to me, that you can take my words and really utilize them more so than I can. It's hypocritical of me to give all of this advice and not really take it. But if just one person can listen to me and to see the light, then all of this pain will have been worth it. So yeah, those are my little pearls of wisdom. Take them as you will. And I just want you guys to know from the bottom of my heart, I really appreciate all of the support and love that has been gifted to me from you guys. And, you know, it really means a lot. Through all of this, to have 400 people subscribe to me, following my journey, listening and wanting me to succeed, there's no words. There's no words. So thank you. I love you guys, and I'll see you in the next video. Bye guys.